In my last video, I talked about the problems with out of control inflammation, which is sometimes called systemic inflammation, how it can adversely affect muscle growth and general health, how it promotes various degenerative diseases, including cancer, cardiovascular disease. After a brief explanation of the dangers of out-of-control inflammation and the benefits of short-term inflammation, especially in regards to muscular growth, I talked about the foods that will tend to exacerbate or worsen systemic inflammation. There are certain foods which in that last video I went into detail and I explained why these foods will make inflammation worse, cause all kinds of problems. So this week I'm gonna go on the flip side. I'm gonna talk about anti-inflammatory foods. These are the foods that you should eat if you want to cut down on out of control inflammation. These foods will not interfere with the normal beneficial inflammation that's needed after, let's say, an injury or a cut or a wound or something like that. It'll just help to control the out of control systemic inflammation, which is very bad. So, right, without this, there are quite a few of them, so I'm going to go right into it. One of the most potent anti-inflammatory foods you can consume are various types of berries. Berries are basically small fruits. They're not that high in fructose, in case you're worried about that. They're low. Some of the more common berries include strawberries, blueberries, raspberries, and blackberries. These berries have been shown to have a very potent effect in helping to, particularly raspberries. There was a couple of studies years ago that showed that it just completely blocked colon cancer in animals, and then they showed it to be true in humans too, to a certain extent. One of the main benefits of eating berries is that they're rich in antioxidants, particularly one called anthocyanins. These provide a lot of the color that you see to these various berries. And these anthocyanins have very powerful anti-inflammatory and protective effects. And one study that involved 25 human adults, those who consume blueberry powder every day produced significantly more natural killer cells compared to those who didn't consume the powder. Now, natural killer cells are T cells, they're immune cells that, among other things, these are the immune cells that attack pathogens that are trying to enter the body, like bacteria, viruses, and they also help to destroy cells that are beginning to turn cancerous. So it's very important to have as much natural killer cell activity as possible. And as you get older, natural killer cell activity tends to decline, and this is one of the reasons why cancer is seen in much greater numbers in people that are over 60 years old. It has to do a lot with DNA mutations over the years. I'm not going to get into that, but another study showed that adults who were a little bit heavy, in other words, they had excess weight, when they ate strawberries, they had lower levels of various inflammatory markers associated with heart disease. These are various inflammatory cytokines that, again, play a underlying role in cardiovascular disease. Another great anti-inflammatory food, which probably a lot of you are already familiar with, is fatty fish. Fatty fish is rich in the what they call the preformed omega-3 fatty acids. Now, there's only two types of fat that are required in human nutrition: omega-6 and omega-3. Omega-6 is represented by linoleic acid, found in a lot of foods, particularly vegetable oils. And then you have the omega-3. Now, the omega-3 that's considered essential is called alpha-linoleic acid. But the truth is that alpha-linoleic acid, or ALA, is actually a precursor for the more bioactive forms of omega-3, which is eicosapentaenoic acid and docosahexaenoic acid, or EPA and DHA. Those are the actual, let's say, biopotent forms of omega-3. Now, if you want to get the omega-3 fatty acids from food, the best sources are fatty fish such as salmon, sardines, herring, mackerel, anchovies, halibut, that type of thing. The EPA and DHA, the omega-3, are well known to reduce inflammation, and they also play a role in preventing heart disease, diabetes, and kidney disease because of lowered inflammation. When you consume these EPA and DHA preformed omega-3 fatty acids, enzymes convert them into very potent anti-inflammatory compounds called resolvins and protectins. These have extremely potent anti-inflammatory effects. Some studies have shown that eating salmon or taking EPA, DHA supplements like fish oil, it reduced the primary inflammatory marker in the body called C-reactive protein. There's a test called high sensitivity C-reactive protein. C-reactive protein is just a generalized picture of inflammation. It tells you that there's inflammation going on in your body, but it doesn't exactly tell you where. In one study, people with irregular heartbeat took EPA and DHA daily, experienced no difference in inflammatory markers compared with those who received a placebo. However, recent studies show that if you take fish oil in higher amounts, over, let's say, 4 or 5 grams or over, there's a 33% increased risk of a type of heart rhythm disturbance called atrial fibrillation, which involves, I'm not going to get into what it involves, it's too complex, but it involves the upper chamber of the heart, the atrium. You get an abnormal electrical conduction there. It gives you what they call fibrillation, which is a very rapid heartbeat, cause a lot of symptoms. I had it myself. I had to go to the emergency room a couple of months back. Not sure really what caused it, but I do use fish oil, but I've been using it for I don't know how many years, and I've never had any problem with it. But from what I could see, if you have high blood triglyceride levels, meaning higher amount of triglycerides, the fat in the blood, it's called blood triglycerides. If blood tests show that you have high triglycerides, you tend to have a greater risk of getting atrial fibrillation after taking a fish oil supplement. Again, it's higher doses. I don't know many people who've gotten atrial fibrillation who use fish oil. I don't really have never met anyone. I had it, but I don't know whether it was from the fish oil or something else. So I'd only had it that one time, never had it again. And I continue to use fish oil because I don't eat fatty fish. I don't really like fatty fish, and I believe the omega-3 DHA, EPA are extremely important to health. They do a lot of good things. So I continue to use fish oil, although I did cut it back. After the research came out showing a relationship between atrial fibrillation and fish oil, I cut back. I was using, I think I was taking about 10 grams a day of fish oil. I take it in a liquid form. I cut it back to 4 grams. So I take 4 grams a day of fish oil. I haven't had any problem at all. Another anti-inflammatory food is broccoli. Broccoli is a cruciferous vegetable. There's other cruciferous vegetables. Cruciferous refers to like a cross type of thing. I'm not sure why, but that they're called cruciferous vegetables. Other cruciferous vegetables are cauliflower, Brussels sprouts, kale. There's research showing that eating a lot of cruciferous vegetables is associated with decreased risk of cardiovascular disease and cancer. And it could be related to the anti-inflammatory compounds. There's one in particular called sulforaphane that's found in these cruciferous vegetables. Now, sulforaphane itself is not really found in the vegetables. I know it sounds contradictory. What's in the vegetables is a precursor to sulforaphane called glucoraphanin. Now, when you chew a broccoli or any of these, or you cut it, any of these cruciferous vegetables, you release an enzyme in the vegetables called myrosinase. Myrosinase converts glucoraphanin into sulforaphane. And sulforaphane has its tremendous anti-inflammatory effects. Among other things, it actually also blunts the release of myostatin, which is a protein in muscle that prevents muscle growth. So it has a lot of good things. But they're trying to sell. I see that they came out with supplements. Some of the supplements claim to have sulforaphane in it directly. Others combine, let's say, broccoli, and they add myrosinase with the thought that the myrosinase will convert the glucoraphanin that's found in the broccoli and the supplements into sulforaphane. Now, the problem with that is, first of all, these supplements are extremely expensive, a lot more than eating the actual vegetables. But the thing that these people don't tell you is that sulforaphane is very unstable. It breaks down very fast, very fast. In fact, if you cook broccoli, you basically destroy all the glucoraphanin and you get no sulforaphane at all. If you microwave it very lightly, or what they call that, flash heating or something, real fast, you preserve the sulforaphane, or the glucoraphanin. But cooking destroys it, and sulforaphane in supplements. By the time you get the supplement, I strongly doubt there's any sulforaphane left. So you're paying like $50, $60 for inactive broccoli tablets that don't do anything. They don't even give you the fiber that's found. It's a complete waste of money. Another great anti-inflammatory food is avocados. Avocados are unique because it's basically a kind of a vegetable. I believe it's a vegetable. I don't know. I guess it's a vegetable. But it's unique because it's high in monounsaturated fats. I think it's one of the only vegetables that is rich in monounsaturated fats. This is a type of fat, sometimes they call them omega-9. Extra virgin olive oil is another great source of monounsaturated fats. They have a lot of health effects. But avocados themselves, besides having the monounsaturated fat, it has a good amount of potassium, magnesium, fiber. It also contains carotenoids, tocopherols, which are the vitamin E family, which help to reduce cancer. There's a compound in avocados that reduces inflammation in newly forming skin cells, so it can reduce any type of inflammatory skin problem. One study that involved 51 adults who were a little bit overweight showed that those who ate avocado for 3 months had a reduction in inflammatory markers, interleukin 1 beta, and C-reactive protein. So there's human proof that avocados are anti-inflammatory. Green tea is a popular supplement. You have the actual green tea itself, and you have the concentrated green tea extracts. They've shown in research that drinking green tea is associated with a reduced risk of cardiovascular disease, cancer, Alzheimer's disease, obesity, and other conditions. In fact, one study, I believe, a couple of years ago, showed that if you get a certain amount of the active polyphenol found in green tea, it's called epicatechin gallate, or EGCG. If you get enough of it, it lowers the risk of Alzheimer's up to 70%. So it's called epigallocatechin 3 gallate, I should say. Again, EGCG. That's what you want to look for in green tea supplements. If you do take it in supplement form, make sure it has a good amount of, at least 200-300 milligrams of elemental EGCG. EGCG inhibits inflammation by also reducing pro-inflammatory cytokines and damage to the fatty acids in your cell. Green tea also, it seems to inhibit enzymes that digest fat. So if you're on a high-fat diet, eating some green tea will help you eliminate some of the fat. And fat is, of course, very concentrated in calories. So other studies show that green tea has an independent effect. It does contain a little bit of caffeine, not as much as coffee, but green tea itself has an independent effect on raising metabolism. And for that reason, it will have a slight effect on increasing fat oxidation when you work out. But green tea, you should know. Also, there's one problem with green tea. Some people have what they call a genetic polymorphism, meaning it's a little bit kind of a genetic change in normal genetic activity, where when they take the green tea, this EGCG, it tends to accumulate in the liver, and it can cause severe liver damage. You might have heard a couple of years ago some of the fat burner supplements. A couple of people had severe liver damage. A couple of people even had to have liver transplants. Some scientists think it might have been from the green tea combined with certain other ingredients in the fat burners, but green tea itself, in large amounts, could, again, only in certain people, it can cause some liver problems. So you want to be careful of that. Green tea also is best absorbed on an empty stomach, but if you take it with meals, it prevents that liver problem. But probably because you get less absorption. That's it. The green tea, again, excellent anti-inflammatory. People in Asia who drink something like 9-10 cups a day of green tea, they show much lower rates of certain types of cancer, like prostate cancer, breast cancer. A lot of these are inflammatory in nature. You should know that a concentrated green tea extract supplement, one capsule is usually equal to about 4 cups of green tea, so keep that in mind. Another great anti-inflammatory food is peppers, bell peppers, chili peppers. They have vitamin C, antioxidants, and they have very potent anti-inflammatory effects. They contain the antioxidant substance quercetin, which reduces inflammation associated with chronic diseases. They also chili peppers contain a substance called cynipic acid and ferulic acid, which are known to reduce inflammation and support healthier aging. There are some studies showing that eating these peppers, they interact with a certain, receptor in the body that, there's some studies show that it actually helps to increase fat oxidation while you're working out. So if you can handle peppers, it's a good anti-inflammatory and it provides some good effects. Mushrooms is another great anti-inflammatory food. Portobello mushrooms, shiitake mushrooms, they're low in calories, they're rich in selenium, copper, all the B-complex vitamins. They contain various phenols, antioxidants. Lion's mane I use that myself all the time. Lion's mane has been shown to increase nerve growth factor in the brain, which can help maintain neurons in the brain so you don't get hopefully stave off some degenerative brain disease. But lion's mane itself, besides increasing nerve growth factor, also is known to reduce low-grade inflammation related to obesity. As I said in the first video, the main health problem associated with having a lot of body fat is that the fat cells, also called adipocytes, release over 100 inflammatory proteins, collectively known as adipokines. There's only about 3 of them that are anti-inflammatory, but most of them are very inflammatory, and that's where the danger of obesity. That's why it causes systemic inflammation. It's why it causes all these, related to all these diseases, cancer, cardiovascular. It's mainly because of the inflammatory effects of these adipokines released by fat cells, and lion's mane helps to temper that. If you cook mushrooms, you will you'll unfortunately lose some of the anti-inflammatory benefits, so it's best to either them raw or lightly cooked. Grapes are also a great. Grapes contain those anthocyanins that I mentioned with other berries. They reduce inflammation. They've been shown to reduce the risk of several diseases: cardiovascular disease, diabetes, obesity, Alzheimer's, and eye disorders, all of which have an inflammatory components. Grapes are a source of the compound resveratrol, which also has antioxidant effects. Some people push it as a anti-aging substance. That's kind of iffy. It does affect. It does seem to increase, slow the aging in obese rodents. But in humans, there's not really that much evidence, but it is a pretty powerful antioxidant. Resveratrol seems to protect the heart against inflammation. In a study of 16 people with heart failure, those who consumed 250 milligram capsules of resveratrol for 3 months showed a decrease in inflammatory gene markers, including interleukin 6. An older study from 2012 found that adults who ate grape extract daily experienced increased levels of adiponectin. Now, adiponectin is also an adipokine released from fat cells, but this is one of the good guy adipokines because adiponectin is associated with increased insulin sensitivity, greater fat oxidation when you're working out, and when you're low in adiponectin, It's associated with weight gain and increased risk for cancer. Turmeric is a very famous anti-inflammatory. It's a spice. It's often used in curry in India. In fact, in India, they have among the lowest rates of Alzheimer's disease in the world because the Indian cuisine regularly features curry. And curry, the yellow color of curry comes from turmeric. The active ingredient turmeric, of course, is what the hell is it? It'll come to me. Anyway, turmeric, curcumin. I'm sorry, curcumin. Curcumin is considered the active ingredient. There's actually 3 kinds of curcumin, but curcumin is a very powerful anti-inflammatory. Turmeric has been shown to reduce inflammation related to arthritis, diabetes, and other diseases. The problem with curcumin is that it's very, very difficult to absorb, very difficult. So some supplements, they combine curcumin with a substance called piperine, which can boost curcumin absorption by 2,000%. However, the newer curcumin supplements are they're kind of liposomal. In other words, they combine it in a little envelope of fat. It's kind of like a Trojan horse effect. It kind of pushes the curcumin into the body. Those type of curcumin supplements are by far the most potent. They increase the blood levels of curcumin by as much as 66 times over regular curcumin or turmeric. So extra virgin olive oil is, again, a fantastic anti-inflammatory. It's one of the keys to the diet that's considered the most healthful diet you can eat. It's called the Mediterranean diet, which emphasizes fruits, vegetables, nuts, small amounts of meat and fish, and a little bit of red wine. But also one of the main points is extra virgin olive oil. Extra virgin olive oil has been linked to a reduced risk of heart disease, cancer, and other serious conditions. It lowers inflammatory markers. There's a substance in extra virgin olive oil called oleocanthal. It's an antioxidant, and studies have shown it provides comparable analgesic or pain-killing effects to anti-inflammatory drugs like ibuprofen. In fact, oleocanthal is considered by some scientists to be a natural, non-steroidal anti-inflammatory drug like ibuprofen, aspirin, and others. It's natural, though. It doesn't cause any side effects. There's different kinds of grades of olive oil. The only one to really buy is extra virgin olive oil. Unfortunately, there's a real problem with commercial extra virgin olive oil. A lot of them are diluted with cheap, regular olive oil, or sometimes even vegetable oil. So you got to be careful. You got to buy genuine extra virgin olive oil. That's the only one that's going to give you benefits. I myself, I take 2 tablespoons a day of extra virgin olive oil. I use either the Trader Joe brand or Costco has a organic extra virgin olive oil. Those are the 2 brands I use. I started using it after I read a study showing that there's a human study where people who substituted extra virgin olive oil for saturated fat in their diet, and it decreased the risk of heart disease by 92%. And that was enough for me. I started taking extra virgin olive oil. I also use it because I take a couple of fat-soluble vitamins like vitamin E, D, and K. When I take them with extra virgin olive oil, the fat in the olive oil ensures that the fat-soluble vitamins will be fully absorbed. That's another reason why I take it. Dark chocolate and cocoa is an excellent anti-inflammatory. Again, it has a lot of antioxidants that reduce inflammation. Recent studies show, I'm going to have a big article in my Applied Metabolics publication about the health benefits of cocoa, because they're really startling when you read about it. And I don't see much publicity about that, so I'm going to do an article on it. But among other things, recent studies show that if you take in a certain amount of cocoa, it has epicatechins, which are certain flavonols that are found in cocoa that have a remarkable effect on memory, especially in people over 40. If you take in cocoa or dark chocolate, it has to be dark chocolate, not the milk chocolate. That's just garbage. It has to have a certain amount of cocoa in there, because the polyphenol epicatechin has to be in the dark chocolate. This seems to help kind of normalize memory. You know, a lot of these people get these senior moments, like I just got one with this when I couldn't remember curcumin. I got to increase my cocoa, but anyway, it helps to prevent that. And I have used cocoa, and I do notice a little bit sharper memory when I use it. It's not a huge effect, but I do notice it. There's a small study where people who consume 350 milligrams of cocoa flavanols daily experience improved vascular function after 2 weeks. Vascular, of course, refers to the blood vessels. And the reason for that is because, and this is a drum roll, please, the epicatechins, or cocoa flavanols, are very potent inducers of nitric oxide. Everybody knows by now what nitric oxide is. It's produced in the body from the amino acid arginine. It's very ephemeral. It's produced. It's like a boom. You know, arginine bumps into the enzyme that converts it into the nitric oxide, and the nitric oxide does its thing, and it's gone in seconds. It's like a ghost. But the point is, it's very potent at dilating blood vessels, increases blood flow to muscles, helps prevent hypertension, and cocoa is actually a better promoter of nitric oxide than a lot of the so-called nitric oxide supplements. So you know, if you want to get it from if you want to get these polyphenols from dark chocolate, make sure that the dark chocolate contains at least 70% cocoa. The higher the percentage, the better. And forget the regular chocolate candy and all that crap. That absolute garbage is nothing for you. Tomatoes are another anti-inflammatory food. They're rich in vitamin C, potassium, and lycopene. One study showed that lycopene can reduce prostate cancer in men by as much as 63%. And lycopene, in fact, is more concentrated in the testes than any other part of the body. It reduces inflammation all over the body. It reduces cancer, and interestingly enough, lycopene is one of the nutrients that is better released from food that's cooked than raw. In other words, they've shown that if you cook tomatoes rather than eat them raw, you get greater lycopene release than eating them raw. So consider that. Also, lycopene is carried in low-density lipoprotein. Low-density lipoprotein, when oxidized, is associated with atherosclerosis. Lycopene and coenzyme Q, also carried in the LDL, could keep the LDL honest, so to speak, prevent it from being oxidized. And if it doesn't get oxidized, it's not going to cause atherosclerosis. Cherries also contain anthocyanins and catechins, which decrease inflammation. Tart cherries have been shown to, in some studies, to help reduce muscle soreness, increase muscle recovery. Let me see, a tart cherry juice. Well, the studies vary. There's a couple of studies that showed that tart cherry juice. Anyway, tart cherry juice didn't have much effect, so it's kind of up in the air. But it's certainly, it can definitely be considered anti-inflammatory. As I recently to recap what I said in the last one, those are the beneficial anti-inflammatory foods. The inflammatory foods you want to avoid, which I discussed in the last video: processed foods, refined carbs, fried foods, sugar-sweetened beverages, processed meats, and trans fats. Those are the inflammatory foods to avoid. So that's about it for this video. Eating these anti-inflammatory foods will go a long way towards helping reduce chronic pain, various degenerative diseases, including brain disease, cardiovascular disease, cancer, and they'll even help you build muscle, because systemic inflammation is associated with muscle breakdown or catabolism. If you want more information on nutrition, exercise science, anti-aging research, effective fat loss techniques, ergogenic aids, hormonal therapy, supplement science, which ones work, which ones don't, women's health and fitness, and many other subjects, subscribe today to my Applied Metabolics publication, www.appliedmetabolics.com. 30 to 50 pages every month, no ads, no association with supplement companies. I'm not going to try and sell you any of these, no supplements. I'm not associated with them. Just pure evidence-based information that also includes my 60 years of experience and study that it can't be duplicated as far as I know anywhere. When you subscribe, if you want, if you send me a email, I'll send you an invitation to join my private Applied Metabolics Facebook page. It's only for current subscribers of Applied Metabolics. Each day I post new information on exercise, nutrition, and general medicine. It's very interesting, if I say so myself. And also on the Facebook page, subscribers can ask any questions they want that they're curious about related to nutrition and exercise. Myself or somebody else, other subscribers, will answer them. You're welcome to leave comments under these videos, especially suggestions for videos, which I feel if I feel that they'll enough people are interested in the topic, I'll try and do a video on it. Also, if you feel that the information that I'm giving you in this video is worthwhile, please subscribe to my channel and let others know about it. And what else can I say other than if you want to have the best friend you'll ever have, go to your local shelter and adopt a dog. They are the best. Take care.